My name is Mohamed Hassan Mohamed. I'm the Deputy Minister of Health of Somalia, Federal Government of Somalia. Today we're discussing about the Field Epidemiology Training Program. It's a program where Somalia has been actually training and producing students and highly specialized epidemiological experts. Somalia is conducted through the National Health Institute, which is supported by the federal government as the Ministry of Health, WHO, and it's been done by AFINET. Also, we get donors who support us, Sweden government and the African CDC. Field Epidemiology Program, training program, is a program that's been initiated to make sure Somalia gets a better skilled and highly specialized detectives of diseases, where people and experts who are working for the ministry and NIH can produce exclusive, reasonable and durable data, analyzing surveillances and making sure we get the latest disease outbreaks that happen in the country. We are very glad and proud as the Minister of Health to conduct this Field Epidemiology Training Program and make sure Somalia's health system rebuilding gets the best and well-equipped epidemiologists. As a country that occurs as the Eastern African region, where the diseases and other outbreaks are happening simultaneously in the country, we are willing and making sure that these students and experts can bring change in the near future. The Ministry of Health, with the support of our partners, are expecting to create an image. So far, we have done a milestone to have 4 cohorts and graduated 71 experts who can do the work that we expect the surveillances cover the country. Currently we have 24 students who are graduating just in few days, where we expect to have also functioning experts go back to where the districts they came from and make sure they practice and produce a data that can be utilized for the system. We are glad that the ministry and NIH and the students and the experts and the workers of the ministry is working simultaneously with full energy and expecting these programs to go to the next level and make sure the government's field epidemiology training go into the next level, into the intermediate level, and make sure we get better donors who can support this program, which we expect to have the best results on the most needed and most important diseases and outbreaks. I want to thank all the experts, workers in the ministry, the students who are graduating today, who have made the effort to make sure the government in the country gets this effort done. I want to make sure we stand with those who graduated and those who are doing now to make sure Somalia gets the most detective and best resulted graduates in the region. We thank you, and we thank all the efforts by Africa CDC, AFINET team, NIH team, and the Ministry of Health team. Thank you very much, and congratulations those who graduate in the next epidemiological training. Thank you very much. One more thing before I actually conclude. I want to thank the team, the experts who are working to get mostly this effort 25% in theoretic work and also 75% in the field to train those experts in the field. Generally, this doesn't happen in other programs that we have. We have seen this field epidemiological training program gets this unique design of experts who are planning to make sure 75% is being conducted in the field. I want to thank the people who are going into the districts, going to the regions of the region. And the way the design of the program is working with the federal member state public health officers and NIH team to make sure this is conducted as a national plan and as a national effort to make sure the field epidemiological training program gets the most from Somalia. I want to thank the team, to thank the ministry, and the ministry is always there to make sure field epidemiological training program gets into the most effective, supported, and scheduled to the next training programs. Thank you very much.